Welcome, everyone. Today, we're diving into a groundbreaking approach to treating heart failure that's rewriting the rulebook. It's a powerful combination therapy, and it has a fantastic nickname, the Fantastic Four. A new team of superheroes, you ask? That's actually the perfect way to think about it. For a long time, treating heart failure was a slow, step-by-step process. But now, we're seeing the power of a combined multi-front attack. So what's the secret behind this new strategy? Well, this isn't just a catchy name. It really signals a massive shift in medical philosophy. We're moving away from that slow, sequential approach and toward a much more aggressive, simultaneous strategy. So, what is the Fantastic Four officially? It's a combination of four specific classes of medication, and when they're used together, they have been proven to not only extend life, but also to dramatically improve the quality of life for patients. And this isn't some fringe idea either. Right now, it's one of the hottest topics in the entire field of cardiology, and it's backed by powerful evidence and major clinical guidelines. So, if this is our superhero team, who are the key members? Let's meet the lineup, shall we? Four key players. Each one has a unique role to play in protecting the heart. Let's see who they are. And here's the team. First up, we have ARNIs or ACE inhibitors/ARBs. These guys work by relaxing blood vessels and blocking harmful hormones to take the strain off the heart. Next are beta blockers, which slow the heart rate, giving the heart a much-needed rest so it can work more efficiently. Third, we have MRAs, which help prevent the body from holding on to excess fluid. And the newest member of the team is the SGLT2 inhibitors. These were originally developed for diabetes, but were discovered to have these amazing protective effects on the heart. Each one fights heart failure from a completely different angle. Now, for the big question, does every single patient get the full Fantastic Four treatment? Well, not exactly. This strategy is actually tailored to each individual. The treatment plan really depends on one key measurement, and it's called the ejection fraction, or EF for short. This number tells us how efficiently the heart is pumping out blood. Generally, a healthy heart has an EF of 50% or more. The lower the EF, the weaker the heart muscle is considered to be. This slide breaks it all down perfectly. See, for HFrEF, that's heart failure with reduced ejection fraction, where the heart's pumping ability is severely weakened. The full Fantastic Four is a Class 1 recommendation. That's the highest level of evidence. For patients with HFmrEF, the SGLT2 inhibitor plays the main role, and the other drugs are considered based on the situation. And for HFpEF, or heart failure with preserved ejection fraction, where the pumping is okay but the heart muscle is stiff and can't relax properly, the SGLT2 inhibitor is currently the only one with proven benefits. And I really want to emphasize this point. For patients whose ejection fraction is 40% or less, the Fantastic Four is now the new standard of care. It's our most powerful tool for changing the course of the disease. Okay, let's clear up a common question. Where do diuretics, or water pills, fit into this new strategy? Many patients are already familiar with diuretics. So where do they stand? Are they part of the Fantastic Four? Here's the core difference. The Fantastic Four are disease-modifying. They tackle the underlying problem and improve long-term survival. Diuretics, on the other hand, provide symptom relief. They're absolutely essential for reducing fluid buildup or congestion, but they don't change the course of the disease itself. Think of it this way. One is fighting the fire and the other is bailing out the water. So, what are the key takeaways from all this? Let's quickly recap the main points. It all comes down to the ejection fraction. If you have HFrEF, the full Fantastic Four team is essential. For HFmrEF, the SGLT2 inhibitor is the foundation of the treatment. And for HFpEF, the SGLT2 inhibitor is the best option we have right now. It's a clear and logical approach to a very complex problem. And just so you know, this entire strategy is based on the latest scientific evidence detailed in the 2021 guidelines from the European Society of Cardiology and their focused update in 2023. The Fantastic Four has truly kicked off a new era in heart failure treatment. The only question left is, which of these superheroes should be on your team? And that, of course, is a conversation best had with your doctor. Thanks so much for tuning in.